By limiting exposure to risk factors, a person can reduce the risk of HIV infection. The preventive measures include: correct and consistent use of condoms can protect against the spread of HIV. Antiretroviral drugs taken by the HIV-negative partner can be effective in preventing acquisition from an infected partner. This is called pre-exposure prophylaxis, PrEP, who recommends that countries implement demonstration projects on PrEP for serodiscordant couples and men and transgender women who have sex with men. Healthcare workers with needle prick injuries in the workplace are recommended post-exposure prophylaxis, PEP. Antiretroviral drugs are used within 72 hours of exposure to HIV in order to prevent infection. Counseling, first aid care and HIV testing are also done. A 28-day course of antiretroviral drugs with follow-up care is advised depending on the level of risk. People exposed to any of the risk factors are strongly advised to test for HIV and other STIs. Mother-to-child transmission, MTCT, during pregnancy, delivery, or breastfeeding can be fully prevented if both the mother and the child are provided with antiretroviral drugs. Male circumcision reduces the risk of heterosexually acquired HIV infection in men by approximately 60%. Use sterile needles and syringes for each injection. Antiretroviral therapy decreases the HIV concentration, viral load, in the blood and in genital secretions. According to a new trial, the risk of transmitting the virus through sexual contact can be reduced by 96% if an HIV-positive person follows an effective antiretroviral therapy regimen. Prevention. We all know HIV is a disease that can be spread from transmitting intrabody fluids, but do you know how you can get it? Here are some things you should do to avoid contracting HIV. Avoid dangerous sexual practices. Avoid intravenous drug use. Follow good hygiene practices. Get tested. Subscribe us to know more health tips and home remedies.